encouragement, my motivational speech now would have been listen to the doctor because he understood the circumstance in which you are in based on the result, or should I say based on the term that they have used in the hospital world, based on the diagnosis. So always listen to the doctor for the medication, especially where you are taking, as well as to follow up with your medical personnel so that your recovery process can be in the best way possible. Physical part of the body, the emotion, because of the worst if you cannot sleep, that's where the emotion part comes in as well.
Okay.
It make you become very unsteady. You cannot think as you would have normally would be thinking throughout the day because of the pain. You cannot focus. So it affects in many areas,
Okay.
many aspects.
Alright.
Christ is calling, calling. Yes, he is. Christ is calling, 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 calling. One is calling, calling. One is calling, calling. I know he is. One is calling, 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 calling.
In Office with Dr. Jevon Samuels.
Welcome to another episode of In Office. I am Dr. Jevon Samuels. In Office is a program which we talk about life, sickness and death, and today we'll be discussing pain medication and pain management. And my guest here today is no other than Mr. Aaron Bonner. Welcome back to the show.
Yeah, man, happy to see you, bro.
Good. Alright. So before we get into the discussion, please remember to share, like, subscribe, and leave a comment on this video. And stay tuned for more informative medical content. Now, pain medication is an essential part of healthcare, and pain medication plays an essential role in alleviating suffering for many patients throughout the world. And we are all familiar with pain medication. Most of us might have taken Acetaminophen, example Panadol, or some form of NSAID such as Advil, right? However, this podcast today, I want to go into more details about the different types of pain medications and side effects of these medications, right? Now, we normally manage pain using a pain management ladder with different levels. So normally we start from the lower level in which we use less severe pain medication. So, for example, weaker pain medications are like Nonsteroidal anti-inflammatory medication, which is classified as NSAIDs for short. And these are normally medications. Some you can get over the counter, some you have to get prescription medication. So, example like ibuprofen, for example, is like Advil in Jamaica. It's readily available to be purchased at any shop, right? So even though it's an over-the-counter medication, it still have some form of side effects. Like it's an NSAID, so you have side effects such as you're prone to get like gastric, so stomach ulcers, or it increases the risk of bleeding. So that is why sometimes we would advise patients to take only Panadol if they suspect to have like a viral illness, because it actually can worsen some viral illness such as dengue. Also, it might lead to other issues with the kidneys. So persons who have kidney issues should stay away from Advil and NSAIDs in general. So NSAIDs, along with Acetaminophen or Panadol, it's normally the first level of pain medication that we use for mild pain that we try to manage these pain, whether acute or chronic. So Panadol, however, even though it's a common medication from persons or for newborn and young toddlers, we give Panadol for even as soon as they get like immunization. However, you have to know that Panadol itself also can come with complications if you use it in excess. So it can lead to liver damage and liver failure, right? Now, the first level of the pain ladder, sometimes doctors might use additional, what we call adjuvant pain management medication, which is not strictly a pain management medication, but it's an adjuvant medication. Some of these include like some of the anticonvulsants such as gabapentin or neurobiline. Also, sometimes use a weak steroid, such as a steroid, not necessarily a weak steroid, but steroids such as dexamethasone in pain management. Also use muscle relaxants such as ibuprofen, and also other medications as well. They use as adjuvant therapy in terms of medication. Now, if we try the first stage, which is the NSAIDs and the acetaminophen, and the pain is still not controlled, the person is still complaining of severe pain, which is causing great suffering, we normally move up the ladder to the second stage, in which we normally introduce a weak opioid. Weak opioids such as codeine or tramadol are normally the weak opioids that we normally start with when we step up the ladder. Sometimes they might mix the weak opioid with acetaminophen. A popular example is Panadine and Panadine F, in which they mix different combination of acetaminophen and codeine, which normally used. Right? However, some of the side effects of codeine, popular side effects like it may lead to constipation. Opiates can also lead to nausea and other different complications and side effects. Now, in addition to the weak opioid, if the person is still having severe pain, now we normally they introduce this level in which they try non-pharmacological therapy such as physiotherapy, or some persons may refer to acupuncture or yoga type therapy to help with pain management, right? But these are normal recommendations for persons that have pain which are not related to a cancerous cause or non-cancerous pain. And sometimes some persons may also refer to behavioral therapy for help with pain management. Now, if all these measures are taken into place, such as the NSAIDs, the weak opioid, the non-pharmacological therapy, and the person is pain is still not controlled, then it's definitely time to move on to the big guns, such as which are called strong opioids. And normally these are medications that are really governed by the Dangerous Drug Act in Jamaica, right? So they are not just readily available to even by a simple prescription. So now medications, we're talking about morphine, Panadine, and like the patch. That is the fentanyl patch, right? Especially in person, they have renal function and they want a patch with a strong opioid instead of taking the oral or the injection form. However, these are normally dangerous medications, so they have actually stronger opioids. They have the nausea and the vomiting may be common side effects of them. They also have it can lead to sedation, so they make some patients get dizzy and weak, and also it might have affect respiratory function. Some persons may also become addicted to these medications, so they have addiction issues and have withdrawal issues from these medications. Even, for example, like some patient with sickle cell disease, normally in sickle crisis, tend to be admitted frequently at hospital if they are not controlled. And these medications at the hospital are still locked away in what we call a DDH cupboard. And normally for each time a patient should get a dose of these medications, then actually the healthcare worker have to actually sign for it and record it in actually the book, so in a book or some other means of storing data, so you can actually be audited at some point in time. And normally, at least the person in charge of the ward is normally given the key to ensure that they are responsible for overseeing the usage of these medications. Now, my guest here, Mr. Banner. Welcome back to the show, Mr. Banner. So again, we have to tell a special thanks for coming on the show to share your medical issues, which is normally should be private and confidential. So we give thanks for those patients who are willing to come and share their information with the public, so that they can become aware of different medical issues and medication that exist, so they can actually learn from other person's mistakes, plus learn how other persons cope with their medical issues and try and apply it to their life. Alright? Now, Mr. Bonham, welcome back to the show again. Alright, it's a pleasure to have you.
Wonderful.
Good. Alright? Now, the chronic pain. So you have hemophilia that disclosed before the first session with you was on hemophilia. Actually, that was the very first interview that I did for this program. You know, so you're actually coming back after a few months of having this program.
That
So
was
I'm happy
like
that you're
inaugural
here. Yes,
stage.
good. Alright, so what are some of the pain medications that you take, and like what are some of the side effects that you're having currently?
Well, presently my problem is pain, as you have made mention of, and I take for me, which is prescribed by a doctor, Panadine F. That is the most popular one for me right now.
Okay, so do you have any, so I mentioned earlier in the interview, like some common side effects of like weak, so that we classify as a weak opioid plus paracetamol, right? So what are some of the side effects that you may have from taking this medication regularly?
Well, there's only there's a minor side effect, so I have like an issue with itching, but it's not something that I feel in a way in which I cannot bear.
Okay. So you have never like any constipation issue with
Oh
the...
yeah.
Oh, okay, that's what I was saying.
Occasional.
Alright. So you're constipated. So what are some of the stuff that you not do? Doctors normally have to prescribe a laxative for you, or you normally just change your diet and to prevent constipation?
Well, there is a pill that I would have gotten from the doctor, because that is something for constipation, which always solve the issue.
Okay,
For
alright.
example, even mineral oil, which is not a pill,
Yes.
that is something simple.
Alright. Now, so in terms of the effectiveness of the Panadine, has there ever been any instance in which your pain is so severe that the Panadine or Panadine F does not work?
Always.
Alright.
Yeah.
And in these instances, what do you normally do?
Well, to be frank, sometimes it's not something I would tell for someone to try, but sometimes I double the medication. But the right thing to do is to get the proper medication, which have been something that is above the level of the one that I'm taking.
Okay, so you have any idea of the medication that you normally get that is above the Panadine?
That one I will get an award, which is Petadine.
Petadine, say.
This doesn't affect me, especially when I get it when I'm feeling excruciating pain. There is one more, the morphine.
Okay.
These are the best ones that I know for myself.
Alright. So in terms of the morphine, when you get in the morphine and the ward, does it like have any worse side effects than the codeine?
To be honest, to be abundantly honest, I don't know how to say, but when I get it through the IV access, I don't have any complication. This is just my experience from the time I've been getting such medication. At home though, when I get the pill, as I said, it's a minor side effect. However, it is not as potent as the one that I would have gotten actually on the ward.
Okay. Alright, so now we discussed that when I was discussing pain management, we spoke about the different levels. But normally before we move to your level that you're at codeine, which is the second level, we normally try like the NSAIDs, which is like the cataflam, Voltaren, and like paracetamol itself. Did you try these medications before, and what was the effect of them? Why you didn't continue?
This is something very important that you're asking, because this is what I learned from my body, because all of us, we have to study our body as well based on how we respond to certain medication, certain class of medication. In this circumstance now, I think is not, can I say, right in the sense of The name you mentioned, NSAID.
NSAID, yes.
Yeah, it's not.
So it's Advil.
Yeah, it's not
Advil,
right.
Cataflam,
Yeah,
Voltaren.
that word.
It's
NSAID.
it's non-steroidal anti-inflammatory drug.
Alright, this medical term that we use is not something that I would approve for me because it affects me in a negative way. Because I have an issue with bleeding, so my blood is thin, so it triggered in the past my bleeding. So I try to avoid this as much as possible. Any medication with NSAIDs.
Alright, so we know that you have hemophilia, so it would have been unlikely for a doctor to go ahead and prescribe NSAID. So is it a case that a doctor had mistakenly prescribed the NSAID for you, or you had bought it over the counter?
Yeah, it was a case in which it was mistakenly prescribed. However, I must say this, that I can get these things, but it must be at a management. For example, like if I'm not really having a bleeding issue, I could get it, but it's not something often. It's just for that time, but not when I'm in like a emergency.
Okay.
So it's something that it can be used, but at the proper timing. Yes.
Alright, so let's talk about how this chronic pain affect your daily life. So like, for you to be basically up every day and in pain, how does this affect your daily routine, like stuff that you can do and cannot do?
So this type of pain, it causes a lot of procrastination because it will affect me actually so that I don't perform at my best. And more so, it can even cause me to go back into the hospital because of the bleeding, if such things should happen.
Okay, so what are some of the things that you have to avoid because of the pain?
Okay.
Activities.
Or I have to avoid excess walking. That would have been the first thing. As well as have to avoid certain issues that will require me to use like muscles. If it is something that happened with muscle.
Okay.
And if it is something in which I feel weak or I've gotten weakened, physically speaking, then I have to avoid things that where my strength is involved.
Right. I know that sometimes to be in constant pain and feeling sick can affect how your family and friends and even your partner relate to you, right? Because I know that even in the past when I was speaking to some person with sickle cell disease, they said that because they're in constant pain, they have issues like having good friends and or even relationship. How has your chronic pain affect you with friends and family?
Well, it's always an issue from time to time because sometimes I just want to have a certain environment in which I can be relaxed. So sometimes I don't really like, let's say, having myself in a lot of conversation or in a spotlight where a lot of people come around. When I'm not feeling well, I think it's best for me to just relax at home. It causes me sometimes to be away from the crowd.
Okay, alright. No, so in terms of, because for example, like I remember in the past, if I have like a toothache or etc., it's like you're very uncomfortable and sometimes it can be stressing and affect your mental health and so forth. So how has this chronic pain affect your mental health or your emotions?
Yeah. But regarding how it affects me, well, there's a very evident issue that it will affect me for sure because pain is not something that depends on the type of pain as well that anyone can bear actually because it affects everything about the body. It affects the mind, everything, the physical part of the body, the emotion, because of the worst if you cannot sleep. That's where the emotion part comes in as well.
Okay.
It makes you become very unsteady. You cannot think as you would have normally would be thinking throughout the day because of the pain. You cannot focus. So it affects improves in many areas,
Okay.
many aspects.
Alright. So I'm talking about how like for example your family and friends help us support your how do they like understand your situation and know that you are in pain sometimes and probably need to stay away from the crowd. Do they see that as you're trying to isolate yourself or they understand?
Over the years, I think those who have known me would have discovered that it's not a presumptuous act of me to be away from the crowd, to be solo, to go in solo mode because of the issue. So they know that it's something that I'm accustomed with. So they just have an idea and say, okay, mature about it and say, it's just because of this issue that he's having right now. So that's why you're not probably seeing him as you would have. So.
Okay. Alright, I think in the first interview you said that you were married once and you got divorced, right? Alright, sorry about that. But you had painful crisis issues from then?
Yeah,
When you were married?
emotionally or physically.
Both.
Well, I've been having issues because there's an old proverb that said that no one is an island and no one stands alone. So it will affect me regarding having support, but I still get support from my family.
Okay.
And there are relatives there that occasionally I would have seen. Even recently I had support.
Fine. So when you're married and you're living together with your partner and you're in pain, does that normally affect the relationship?
Yes, affect the relationship, but that was not really the main reason for the relationship where it is at right now, being separated. This was just something to learn, to grow about.
Okay.
Because relationship involve these things. If it is not physical where illnesses, because even making a vow, say until death do us part, in sickness and so.
Yeah.
It's just something to learn and grow about. Yeah, so yeah.
Alright, so we can move on to like your healthcare management. Like, do you normally attend clinics to get this prescription, or you go to the private doctor, and how frequent?
Well, for me, I would go there, not really private doctor, but people that I know very well. For example, Dr. Jevon, especially the hematologists who study about the blood.
Yeah.
So these are persons that I would have go when I'm having certain issue. I don't really go private doctor for anything.
Okay. So in terms of because you're on pain medication constantly, I know that these medications are normally expensive, So do you have any challenges affording these medications, or are you able to access them regularly for free in the government system?
Well, I must say kudos to the government system because it's free for everyone who are in need of such medication. So that's my way of saying it. And for me, it's free, so I could access it whenever I can.
Okay.
Especially when I'm in a crisis.
Okay. So is there about a time like if the government system is out of the Panadine that you take frequently, what do you do in those instances?
Well, I think the best thing is to go to the hospital, be admitted if it is that serious.
Alright. Now, so in terms of like goals that you have for your pain management, you're in constant pain, you have to basically take pain medication every day. Or how often do you take medication by the way?
Actually, every other day.
Every other day?
On an average scale, so.
Alright, and doctors normally ask patients like severity of their pain, like 10 being the worst pain in their life, 1 is mild pain, and the other numbers in between. What level of pain, severity of pain do you normally have when you can take Panadine?
Well, my pain issue is always at 8 up.
8 up? So if your pain is at 10, then the Panadine normally works?
Not when I take it the original way. For example, because I have a knee issue, or sometimes I have a next problem like my cough.
Yeah.
So the pain medication is not sufficient. So That's why I said that I may have to get something above this so that I can better manage the pain.
Alright. Now you had mentioned earlier that you were doing something horribly wrong when you're having excess pain. Sometimes at home you're overdosing yourself with the medication.
Precisely.
So, but by now I know that I've explained to you like some of the side effects of opioid medication and pain medication in general. That it can basically affect respiratory problem, can make you be very drowsy and sedated, alright? But why would you still go ahead and overdose yourself with medication even after being knowledgeable about these side effects?
Well, as I said, it's a personal issue. So if I have my faith in such way that I must help myself, I'm not saying that it's the right thing, it's just that there are times when there's exceptions that I realize is either I bear what I'm feeling if I cannot get this pain over with, or I try to help myself in dealing with these issues, even though, as I said before, it's not something I would tell someone to do. So that's just how I can, the best way I can expound on such thing.
Okay. Alright, sometimes, as I mentioned before, that sometimes for non-cancer guys, not like your pain is due to cancer. For non-cancer pain, we normally do some non-pharmacological pain management, physiotherapy, and also refer patient for acupuncture or yoga and those stuff, or behavioral therapy, right? Cognitive behavioral therapy. Have you ever tried some of those non-medication therapy for pain?
No, I have never experienced such thing.
No, you have never tried. So,
The acupuncture, I've heard about it. That's the Chinese called
Yes.
tradition. I've seen it before, but I personally, I don't have it as an experience for myself.
okay. Is there any reason why I think you would not have interest in those alternative pain management strategies?
No, let me say, I don't put myself not having interest. It's just that I have never probably thought of that. Like you explained, I
Yes.
probably can't think about it. So.
Alright. No. From the last time when you were here, you had issues like you wanted a driver's license or a learner's license. Talk about those stuff now. Let's say they're making progress on this show.
Yeah, this is wonderful to speak about because there always a time in life in which God always ordaining someone to assist. It doesn't have to be like people that you know growing up that can send an angel. And right now there's an earth angel, God using him, and he's assisting me in this driving because this is very essential for me since I have an issue sometimes with my leg where my muscle get strained and not able to do my regular chores. So as I said, this is something fantastic for me regarding the help in which he's giving me. And I must say that I pray that sometime in the future you can be richly rewarded.
Alright. So where are you with the driving now? You're able to drive now, reverse and all those stuff, Mr. Banner?
Well, right now regarding the driving, I'm at the novice stage, but somewhere I can say I've started, which everything has a beginning. So I know that this is where I will go from, so I can help myself better in everything possible.
Alright, so from the last interview until now, you were mentioning some stuff about some animation and graphics. So where are you? Where does this concern now?
Yeah, well, a very important audiobook by the name Lions of the Eagle, which I know that if anyone sees it, they will be astounded because I have done research about audiobooks and I have not seen anything like what I have produced thus far. This is a world-class standard, and I even can say that I have seen world-class standard, still not, and I'm talking about audiobook, not animation and TV. Just a book itself where you can read, listen, hear the voice. I have not seen the class level that I have publicly displayed. So I pray in the future I could probably show something, because you know, as I said, I'm a very upfront person, and I like to inspire people in the right way, especially the medical staff. As I was speaking in the past about that, these people are so important to me. You know, I have these on high priority, or probably the highest priority regarding society, because of the bloodline, you know, the hemophilia, which people know who have studied this thing, coming from Queen Victoria of Germany. So those who perform in this area regarding the blood, like hematologists, you know, doctor and all who would have assisted me in recovering, these people are family for me, not just being a doctor, as you have seen many people go to doctor. I see these ones as my family, since the Lord used these for my recovery process.
You're passionate about becoming a rapper, right?
Sure.
And from the last time till now, any development where your rapping career is concerned?
Well, you know, it's really a hobby. It's what I did is just like for fun. But you know, I always tell myself that I'm an inspirational person, and I am a very much biblical-minded person, whereby in Ephesians 1:23, which states that, which is His body, the fullness of Him that fills all in all. So imagine, let's say there's a scenario. This is just an illustration of God sending a particular human being, which is a body, right, that He used to inspire everyone around Him. So I'm thinking of this person as myself, that fills all in all, and I see myself as a model of this age and of all ages to come. So whatever I am doing, I make certain that I give my best for the sake of not those who are here, but for those that are coming as the next generation. So this is just my mentality and a general perspective of life.
So that song that you sang for us at the first interview, which I think you did the chorus. Did you have the entire song now? Can you share with the viewers? I would probably allow you to sing the song this time.
This is very, very important, because I talk about inspiration, and I pray that this will inspire someone. It's something that I really think about. And this song is a rapping which I have originated from a long time. It's just that I didn't put it out on the air. So I'm gonna rap this, and I want you to listen to this, and I hope that you'll be inspired.
Oh, you have a rhythm?
Yeah, I have a rhythm to it,
Alright, so well.
and I want you to hear this. Christ is calling, calling. Christ is calling, calling, calling you. Hello, you people, hey y'all. 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 Gotta know Christ. You got to know Him. You gotta know the one who can give you everything. If you have not love, you have not joy. You need to know the one who is the mother of them all. The glitter and the glamour we desire to have. But what about the soul which is more precious than gold? Christ is calling, calling. Christ is calling, calling. Yes, He is. Christ is calling, 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 calling. Oh, you need to know Him. You need to know Him now. You need to know Him before time runs out. Listen, if you have not Christ, you have not hope. If you have not hope, you ain't got a future. If you ain't got a future, you'll be suffering. Let me tell you this. Let me tell you this. So just let me tell you this. Christ is calling, calling. Christ is calling, calling. Yes, He is. Christ is calling, 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 calling you. Oh, the one is calling, calling. The one is calling, calling. I know He is. The one is calling, 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 calling you. Oh. Hello, you people, hey yo. 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 You gotta know Christ. You got to know Him. You gotta know the one who can give you everything. If you have that love, you have that joy, you need to know the one who is the mother of them all. The glitter and the glamour you desire to have. The word about the soul to more precious than gold. Christ is calling, calling. Christ is calling, calling. Yes, He is. Christ is calling, 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 calling. The one is calling, calling. The one is calling, calling. I know He is. The one is calling, 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 calling. We need to know Him. We need to know Him now. We need to know Him before time is out. Listen, if you have not Christ, you have not hope. If you have not hope, you ain't got a future. If you ain't got a future, the same. You're the suffering. Let me tell you this. Let me tell you this. Just let me tell you this. Let me tell you this. Christ is calling, calling. Christ is calling, calling. I know He is. Christ is calling, 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 calling you. The one is calling. The one is calling, calling. I am the one. The one is calling. The one is calling, calling. The only one. The one is calling, 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 calling you. Let me tell you this. America. Let me tell you this. The Caribbean. Let me tell you this. Australia. Let me tell you this. Africa. Let me tell you this. Asia. Let me tell you this. The uttermost part. Christ is calling, calling. Christ is calling, calling. Yes, He is. Christ is calling, 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 calling you. Oh.
That's it?
No.
Alright, Mr. Banner, well done. Alright, so basically at the end of this episode, but is there any final word you want to tell the public about pain medication and management?
For sure.
Experience?
Well, my word of encouragement, my motivational speech now would have been listen to the doctor because he understood the circumstance in which you are in based on the result, or should I say based on the term that they have used in the hospital world, based on the diagnosis. So always listen to the doctor for the medication, especially where you are taking, as well as to follow up with your medical personnel so that your recovery process can be in the best way possible. That would have been my word, as this is in office, right? Which we can expand on how we can heal ourselves on a general scale.
Alright, Mr. Banner, well said. Thank you very much for coming as usual, alright? I'm grateful.
Be sure to subscribe for more informative contents on life, sickness, and death.